Hi, hello everyone. Welcome to the second day of STEMathonX workshops. Today we have Dr. Singhal from Canada with us, and he'll talk to us about the medical field and about surgery in general. So without further ado, let's get started. Just like yesterday, if you have any questions, feel free to unmute yourself, or you can put them in the chat if you want. And we're gonna start with some pre-submitted questions and questions that me and Rishit came up with. Then we'll move on to the chat questions as we start running out. Okay, so the first question for you, Dr. Singhal. Can you talk to us a little bit about what you do specifically in surgery and what your day-to-day life looks like in the medical field?
Oh, sure. Absolutely, yes. So first of all, I'm a family physician. And so in my day-to-day life, I do a lot of internal medicine assessment and psychiatry assessment, although I do procedures and I do cosmetic procedures. Pre-COVID pandemic, I would see approximately 50 patients in the day from 9 till 5, and involving assessments of all sorts in all areas of medicine. Certain procedures like joint injections or dermatology procedures also are done during the day, or pap smears. And yeah, it's quite a busy, hectic pace for a fee-for-service private physician in my geographical location in Vancouver, Canada.
That was cool. So you start pursuing an occupation?
You know, probably when I was about your age, I really kind of came to me that this is seems to be a very interesting, extremely vast area of knowledge and potential. And I often thought that you would have, or I would have, a great deal of professional satisfaction and stability. At a practical level, I would always have thought that medicine is fairly recession proof, although the pandemic might have shown that for many that's not the case. But yeah, I just always thought that it was extremely interesting and vast and limitless in terms of what one could pursue.
So what would you say to the people today who are interested in the medical field also, as they're like around the similar age where they start forming like dreams, or almost they start getting inspired to join the medical field? Do you have any advice for them?
Yeah, I would say talk to medical practitioners that you know, either through your parents or your school or anywhere really. You could volunteer at different offices or hospitals or emergency rooms. I would say be around the environment and talk to medical professionals themselves in terms of what it is that they do, and if that's at all something that would interest you. I mean, I think um, it's hard to get hands-on experience, but you can certainly get um, through osmosis, and you could ask directly other practitioners.
Yeah, so during the pandemic, lots of high schoolers or lots of people who are aspiring to be in the field have been stripped of these opportunities because it's kind of hard to do this stuff when the pandemic's going on. So do you have any opportunities, or do you know of any opportunities that we can do remotely or we can do during this time period?
That's a good point. With the pandemic, there are risks, and probably it's not the wisest thing right now to be face to face, especially as a volunteer. I mean, as a volunteer, I think it's just impractical. But I think for where you're at, I would almost say that you know, speaking realistically, you're not going to be face to face or hands on. So speaking, I really don't have a great idea as to who you could contact, but any physician's office, or if you know someone in particular, I would ask them and say, you know, what could be my role? It's everything is local. So whatever, so I'm in Vancouver, Canada. Our COVID numbers are much less, but even so, um, compared to the San Francisco and San Jose Bay Area. But even so, we still are limiting our face-to-face interaction. So it's now the pandemic won't be forever. So when the pandemic numbers die down and everyone's getting vaccinated and this sort of thing, that's really when you'll have your opportunities. I think when things go back to normal in terms of other exposures that you could have.
Yeah, that's interesting because lots of people feel like there's not been many opportunities, but that's helpful. Thank you. Another question we have is when performing surgery, how do you feel about pressure? Or is there any pressure in the first place?
Well, I do a lot of procedures, joint injections, Botox, dermal fillers, things like that. I think the biggest thing is if you know your anatomy, you know the complications, you know your skill sets. There really shouldn't be pressure unless you're really far out of um, your your competencies and your skill sets. And so I suppose things could go if aren't going the right way, you should know how to deal with the complication. I think that's if you know that, then the idea of pressure shouldn't really be there because you can anticipate what could go wrong and plan for that ahead of time. So I guess pressure would be there is if if you're really going above what your training and skill sets have, right?
Oh yeah. So as many of us know, the path to medical profession in college is not easy. So what are some of the difficult things that you had to go through in college and how did you persevere through these and overcome a lot of the difficulties that many people talk about?
Maybe you could tell me what people talk about, then I could answer it from there.
So right now, lots of people say that the medical field is like one of the hardest fields to get into. Like you have to have really good test scores. It's almost like cutthroat competition to get into medical school. You have to do like all this research. So what difficulties did you face? Like
Right.
how hard was
So
that competition?
yeah, I would say even when I was applying for medical school, competition for admission was very competitive. Uh, at the time, you definitely needed to be a good student. I think you always have been. In today's world, I can speak of across Canada, admissions committees look for all kinds of things that I would have never thought one would look for. There's Olympic athletes, high level sports stars, musicians, in addition, as you say, to research or other areas of life. So I even wonder in today's world if I would even gain admission into medical school in terms of that. I certainly was not an Olympic athlete or anything like that. But having said all of that, um, I at this stage in my career, I train and I've trained physicians for many years, and I don't know if that's always the necessary things that are needed. Um, Definitely being a good student, performing well is part of it. I think on top of that is being a well-rounded individual, knowing who you are. Um, and I think each individual uh, medical school would have their own criteria for how they look for the candidates. So, I think for myself, I was always a good student and I'm fairly well-rounded. I think talking to people and knowing how to talk to people is another skill set that should be there.
So talking about this and bouncing off this idea, what path did you take to get into medical school and reach the place where you are today? Like maybe you can talk about starting from high school all the way to where you are today.
Well, okay, sure. In high school, I was just I was a naturally I did very well in say math and chemistry and physics. I think I was the top student in the school. However, that alone isn't the only things. I don't know in high school if I ever made any kind of I don't know if I was really thinking to the level of, okay, I definitely want to go into medicine right away. What I did is I entered pharmacy school out of high school, or actually general sciences, and then I went into pharmacy, which I ended up completing. And I was actually working as a pharmacist in the interior of British Columbia, and I was filling in for the director of pharmacy at the time. And I had applied to medical schools as well, and I had gained admission um, after interviewing at a few medical schools. And so I think I think the biggest thing is definitely to be the competition for medical school is there, and that involves certainly marks oriented in school. And then I think the other big things nowadays, what you do extracurricularly may have some impacts. And, you know, like I said, there's many people who've gone to the Olympics or so on, and or have done research, as you're saying. And all of these things are taken into consideration by different admission committees. They have their different routes and their different setups in terms of how they accept applicants. And I think it's very, very particular for the individual school, medical school, as to how they look at that. So it's hard to say there's one size fits all.
Yeah, for sure. Being like a doctor for a long time and having the experience that you have, what traits do you think a good doctor would have, like personality traits?
Yeah, I think being intellectually curious, wanting to know the diagnoses, where diagnosis is often pattern recognition, but often you need to think outside the box. If the diagnosis and treatment aren't going right for the patient, having humility and recognizing that you're human and that you could be making a mistake should help. Uh, Recognizing your knowledge and skills, and more importantly, recognizing your knowledge and skills shortcomings and who else might be able to help in the picture are also important. So I think the idea of being able to work in teams and work with different people as well as the patient, um, and being a good communicator, those are all very important skill sets.
Yeah, okay, so let's move on to one of the pre-submitted questions that we got. What sort of practice do you get before you start actually operating on people? Like this could be back in school. Like how did you practice so you could gain experience before you operated on an actual person?
Well, there's all kinds of layers of checks and balances where, for starters, you're a student, a medical student, so you'll be a very low participant in the team. So there will be experienced practitioners who are doing more of the procedures, and they'll have senior fellows and residents and so on. So you're very low down the chain. So as you start learning more and more, you're gradually um, learning more autonomous skills. So at some point during that training process, uh, you will go through lots of exams and lots of tests and lots of experience. And when you pass all of that, then you're an attending. When you're an attending, then you can do certain procedures that you're mandated to do.
Okay, thank you. Yeah, I think that was something a lot of people were curious about. So that answer definitely helped us clear up that thought. Another person asked, what medical program did you attend and what did you think of it?
Well, I attended the University of Alberta Medical School, and that's in Edmonton, Alberta, Canada. And I thought it was outstanding. I thought it was a really great program. Um, I did a lot of things that probably a lot would not do today, especially I see when I'm training the attending physicians who I'm a principal physician and I have a lot of associates who've worked for me over the years. And I can see that, you know, up in the rural areas, for instance, in my training, you would have thrombolized heart attacks and stabilized neck fractures and things like that, that often one wouldn't do in a larger center or teaching center. You'd have subspecialists do a lot of this sort of work. Um, Now, I'm in a large center now in Vancouver, Canada, and I certainly won't be doing a lot of things that are done in an emergency room setting or an intensive care unit. Um, but I think the exposures I've had over the years, especially in rural training, dealing with many, many different things, have really helped me in terms of what I do today. I mean, in the rural setting, I used to do cardiac stress testing and gastroscopies and things of that nature that help me today have gained skills that I wouldn't have had if I didn't have that sort of level of training in the past.
Yeah, so going off that thought, lots of people know that surgery is like a really vast field and there are many specific parts of it. So someone in the pre-submitted questions list asked, What are the various fields of surgery and what specific field do you operate in?
Well, I'm a family physician, so I'm not a general surgeon, but I do cosmetic procedures as part of what I do. But in terms of surgery, there are just so many subspecialties. First of all, there's general surgery, which is you know, the bowel sort of things and breast issues, things of that nature. There's plastic surgery, which is a molding surgery. Um, Things like trigger fingers or, I guess it's often perceived as being cosmetic in nature. There's ear, nose, throat surgery or otolaryngology. There's ophthalmology for the eyes. There's just, orthopedic surgery for bones, gynecological surgery. I mean, there's so many different subspecialties or different fields of surgery that there's just so many to speak to. I'm not sure if I can answer your question fully, but I mean, there's just so many different types that one could choose from.
Yeah, there definitely are a lot of fields. So hey, let's move on to some of the chat questions now. We can bounce between the chat questions and the pre-submitted questions. So someone in the chat asked, there are many paths and fields in medicine. How do I know which one is right for me?
It's a good question. And historically, during medical training, you would have a lot of time to think, okay, this is the field that's best for me. In Canada, I think you need to make your decision earlier and earlier in your training, and and kind of select your electives and things of that nature that kind of fit in with the direction that you're going towards. So if somebody wants to do plastic surgery, for instance, they would start gaining electives earlier and earlier in their field of study before applying for that match. In different areas, I imagine you can. I don't know exactly everywhere how it works, but you would apply to particular programs for whichever field you're interested. But how do you know which one is right for you? That involves knowing who you are and what you enjoy doing, I guess, to a large extent. And I guess you can only do that by gaining some experience, and mind you could change your mind in terms of what you want to do. I find being a generalist that I've done all kinds of different things, and it allows me to toggle into different areas. But I think the world is changing where everything is becoming much more specialized. People train in a very special field for a much longer time period and devote their time to that one special field. So the world is changing a lot in that direction.
So are there any specific personality traits that match up well in certain like surgery fields or certain medical like parts of the medical field?
Well, I think you could argue that there's certain stereotypes of different personalities. There's a surgeon's personality, a internist personality, a psychiatrist personality. There's kind of a running joke that um, the general internists know everything but do nothing. Um, General surgeons know nothing but do everything, and psychiatrists know nothing and do nothing. Now that's a kind of a joke, but the reality is that there are all kinds of stereotypes in terms of what different medical specialties or surgical specialties do. At the end of the day, I think having matching your own personality and your own skill sets to doing what's right for the patient is really what boils down to. So I mean, um, it's such a journey and an individual journey. I don't know if there's a one size fits all answer. Uh, People can have different sorts of personalities and do very well in different sorts of medical fields, I think.
Yeah, thank you. That's really helpful. Someone else in the chat asked, what is the most common broken or damaged bone that needs surgery? Like based off your experience.
Well, that's an orthopedic surgery question. So I'm not an orthopedic surgeon, and most common are broken bone. I mean, common bones that are broken are the collarbone or um, you know, the wrist bones. So, but they don't always need surgery, often can be treated without surgical means.
Oh, okay. So someone else also asked in the chat, where do you see the future of surgery? Do you think that robots or artificial intelligence will ever take over, or will they always do a better job than humans? Like, what is your forecast or outlook on it?
Well, I'm not an expert in artificial intelligence or robots. I think it's a good question and it's something to ponder. Certainly, artificial intelligence and can take over driving. Can it take over surgery or diagnostics? It's a hard question. I can't foresee that in the near future. I don't know what it would be like in 20 years, 30 years from now. I think you've still got to have, you need humans involved in assessment and treatment.
Yeah, that's definitely like a complicated field to think like make predictions about. Someone else also asked, being a surgeon, you probably use lots of tools and like technologies every day. So could you walk us through some of the tools that you use in surgery?
Well, again, I'm a family physician, so I'm not a general surgeon. So I do procedures. Uh, when I was in the rural areas, I used to work more like with emergency, and I would then attend in the surgical suites with a attending surgeon for things, all kinds of different procedures. But it starts with a basic scalpel. I mean, I do a lot of removal of moles and like cancers of the skin using a scalpel and scissors and sutures. Um, I also inject joints. Um, and then I do cosmetic work where I use cannulas for filler and things of that nature. But there's all kinds of different tools depending on the type of surgeon one is. So an orthopedic surgeon will be using a lot of different tools than say than a gynecological surgeon would.
Okay, yeah. What about technologies? So along with the tools, you have to use like certain technologies. Could you walk us through some of those?
Well, I mean, the technologies that have evolved has largely been around laparoscopy, where way in the past you would be everything would be opened up. Now you can view things with a camera. So you can kind of make a small hole, put the camera in, and without opening up the whole cavities. So that's probably one of the biggest technological advances, certainly in that I was witnessing in my training and has evolved fully now, where laparoscopic surgery is helpful for um, recovery and things of that nature. Are more technologies being developed? Yes, of course. And as you touched on with robotics and artificial intelligence, but at the time, these are largely tools that currently, and time will tell what other technologies can evolve. And of course, you know, if you look at your cell phone, um, there's more technology and data in that than the NASA station when they launched the rocket to the moon, you know, in terms of the amount of information. So, and it grows so fast. So, I mean, different technologies are being advanced, but right now I don't have a great idea as to what exactly is out there, what can happen in the next 5 to 10 years. But I think during that time period, it's largely still going to be human involvement.
Yeah, for sure. Someone else in the chat also asked, a lot of speakers we had yesterday worked in groups often in their companies. Like whether it was biochemistry, aerospace, they ended up working in teams. How often do you work in groups in your profession?
Right. Yeah. So I'm a principal physician in my medical office, and I do a lot of teaching to other physicians, especially if they were um, provisionally licensed in Canada. Um, but largely, they are independent practitioners, and I'm an independent practitioner. So we do have we have had teams of um, nursing staff who can be delegated to do certain tasks. And largely we work in a team in a sense that we do have support staff as well. but largely seeing a patient would be one-on-one between the practitioner and the patient.
Okay, yeah, I see. Also, are there any notable differences that you know of between hospitals in the US and Canada, since you are located in Vancouver?
Uh, well, I mean, I've not worked in a hospital in the United States, but from what I've seen, there are differences in both the medical legal environments, the and in Canada and the U.S. There's a lot of large groups of, uh, I guess, employers of physicians in the U.S. Where you might work for a group like Kaiser Permanente or what have you. In Canada, largely you don't work for somebody else. You largely work for yourself. You're largely self-employed, and you run your own small business, if it were. So, I mean, that may be a little bit of a difference.
Yeah. Okay, so someone in the chat also asked another question about COVID-19. How exactly has it affected like the medical field in general in Canada?
Well, right now, for instance, it's a huge difference. Prior to the pandemic, I would see patients face to face, period. There would be really no telehealth or anything like that. And now, since the pandemic, the majority of my day I'm doing telehealth, just as we're meeting through Zoom today. Um, Largely, we'll use other modalities to try to not see patients face to face with breathing and this sort of thing. But we do have personal protective equipment, and when I need to do procedures, I will bring the patient in and we'll wear personal protective equipment and do so. But we're certainly trying to limit elective procedures that can wait. Now that the vaccine has come out, we're anticipating that there will be a lot safer environment where we can, we don't want to postpone procedures too long, but if we can postpone them within a reasonable time period, it's probably better for some patients that we do that.
Yeah. Okay, so someone also in the chat asked, do you think medicine still has the potential to grow and advance, or are we or have we already like reached the peak of our medical knowledge? How do you think it'll grow in the future?
Yeah, that's a really good question. I think the knowledge and research into medicine is still vast. I mean, look at who would have thought of COVID-19 a year ago or more than a year ago. There's always areas that are growing. In fact, that's an area of infectious diseases. There's still more information about genetics and the genetic code, and uh, it is vast. The field is vast, and I think we'll always be learning. We've definitely not reached our peak.
Yeah, I have like similar thoughts as well. There's always a lot of new stuff that's coming up pretty often. Someone also asked in the chat, do you learn new things about the anatomy of humans every day, or do we already know everything there is to know?
A good question. My work with cosmetics in particular, one of the interesting things is the facial anatomy. And to know that, I mean, cadavers have been examined since humans have been around, cutting up cadavers and seeing the anatomy, the arteries, the nerves, the veins, these sorts of things. What's interesting is that there are variants of normal. So some arteries, for instance, that there could be a percentage who don't have them in quite the place that you think they might be. So in that sense, it's a humbling experience to realize that, well, yes, it's likely that an artery is here, but it might be different in someone else, and you better know what to do if for some reason you can't foresee that. So the anatomy hasn't changed, but there are variants of it all the time, and so that's humbling.
That sounds pretty cool. So someone else also in the chat asked, how often do you have to conduct research in your job? Or is that a part of your job at all?
So I'm not a researcher, so I don't do overt research. I mean, I research in the sense of a clinical perspective. If I need to know some information that I don't have a good sense of, or I will refer to someone else potentially. Um, but I think the bigger context, how often do I conduct research? How often do you have to conduct research in trial? I mean, I think there's always learning. Like I would say, almost every day, there's something I'm looking up with the information era the way it is, uh, at point of care with different tools. Um, if the sense of research, you're researching around an individual patient, and that can be almost every day.
Okay, so you're never doing any formal lab research, right?
I'm not a lab researcher. No.
Okay. Someone else also in the chat asked, during COVID-19, do you perform as many cosmetic operations as you normally would have the before? Or has the number of people coming in for cosmetic surgeries gone down due to COVID? Because some people deem cosmetic surgeries as like non-essential.
Yes. So So procedures in general have gone down because of the pandemic. We're also trying to limit our in-person visits. So things that can be postponed, we will try to postpone.
Yeah. Someone else also asked in the chat, what are some fun things you enjoy in your job, and how much do you like experience these fun things? Like what are the things you look forward to?
Right. Yeah. I think some of the fun things are making a diagnosis and a treatment um, that really enhances someone's life. I guess that would be professional satisfaction. Um, I mean, there are some other fun things around the, you know, that um, when you say fun, I guess cosmetics to me is a little fun because you're enhancing somebody's appearance and that's fun for them and more of a fun sensation, without necessarily taking away the seriousness of some of the things that are done. So, I mean, I think there's a combination of both, is that there's an enjoyment of making a good diagnosis, helping someone actually improve. And there's also some enjoyments of someone looking better. And I think that's years ago I would have thought that would have been somewhat frivolous, but now I feel that for many people that makes them feel a lot better than what they used to feel like. So um, that's fun too. I think it's all fun.
Yeah, for sure. So with all the experience that you have in the medical field and like the long journeys you've taken, is there anything you would have done differently if you had the opportunity?
It's a little bit of a moot question because I definitely it's a hypothetical. I think things just worked for me the way it did, and would I do it different? I really don't know if I would. There's for where I'm at today, it's because of all the different things that I've done and how I've done them. And so if I were to have changed that, it's a little bit like Back to the Future, the movie Back to the Future, where if you were to change things, it just would turn out differently. So, I mean, I could say maybe to do less undergrad time or something like that, but I don't know if that would have made some of the other things that I've done not come to fruition. The things like when I finished in family practice, at the time, uh, for about 3 years, I did GP psychiatry consultancy work. And I don't know if my work as doing undergrad or what have you had any role with that. Um, but I did all kinds of interesting things. And so I think um, if I did a different path, I don't know what else where I would have ended up. I could have ended up doing something entirely different than what I do today. So um, I guess you could always look back and say, I think there's this big thing in the medical field is undergrad just too much time to study and taking you away from the rest of medical training, right? I think that's one thought. The other thought is for for medical training, you start off training in many generalized areas, and for many you end up in a very specialized subfield. And did you need all that undergrad and general training to end up in a very specialized subfield? And does that serve you any purpose or good? in that field. Uh, you know, I don't, I'm not the one to give the answer to that. However, I know that that's been thrown around as a question. Um, I think the more knowledge you have in in the medical field, the better whatever it is you are, you'll be, because you have a bigger sense of the larger picture. So, I do think gaining knowledge in different areas is helpful to all.
Yeah. Okay, someone in the chat also asked, before the pandemic, how often would you perform surgery?
Well, before the pandemic, I would do procedures much more commonly, um, at least a few procedures a day. Now, during the pandemic, um, as mentioned previously, is that we're limiting the amount of procedures if they're elective, or trying to limit them. So, I mean, I still do some elective procedures, but it's challenging because my time is needed for telehealth, because I do more than procedures. I do a lot of internal medicine and psychiatry in my practice, as well as, for that matter, dermatology. And the dermatology that I do, we use technology for. We can get emailed pictures and Zoom and you name it. So we really are trying to do as much as we can with social distancing. Um, so the amount of procedures have come down quite a lot within our group.
Yeah, yeah, for sure. Also, one of the pre-submitted questions included, what is the most interesting thing that's ever happened to you, like in your career? Could you recall like the most interesting moment you've ever had? Could be something fun.
The most interesting moment and something fun. Um, Interesting moment, something fun. Okay. Um, that's a good one. I wish I have to think. There's so many. Uh, the interesting and fun. Okay, there's a condition called transient global amnesia, where for 24 hours people can forget uh, a lot of they have amnesia basically for 24 hours, and it improves. And I've seen a few cases and diagnosed a few cases like that. And I think what's, what was fun is the patient. Uh, this is up in Alberta. Was having a just the way that the patient was talking was a really kind of a rough way of keep talking about his truck sort of thing, and not knowing where it was. And it was just humorous because of the way he was speaking, but it undermined that, well, this fellow is going to improve. We can expect that within 24 hours he'll regain his thinking skills and abilities. um, but I remember just uh, kind of trying not to laugh at some of the colorful language he would use in everyday talking while describing these things. And I just remember laughing to myself when you asked me the question. It still, I guess it must have jogged something in me that I found that kind of funny or fun. To be laughing while you're working is always a fun thing.
Yeah, for sure. Someone was also wondering, what are the possible risks and complications involved, like the surgeries that you do?
Right. Yeah. So with cosmetic work, um, if you inject filler into an artery, that arteries can feed the face. And in particular, the biggest risk would be blindness. If you inject filler into certain arteries of the face, it could go to the optic arteries. Uh, and if you don't recognize that's what you're doing and you're not dissolving it, really bad things can happen. You're causing lack of blood supply to different areas of the face. But the worst would be blindness. So yeah, that's, as discussed earlier, you should know how to deal with complications before they happen or while they're happening.
Yeah, okay. And then the last question we have from the pre-submitted list is, what types of places do like general surgeons work at? Like, are there hospitals? Do they run their own practice? Could you shed some light on this topic?
Well, again, I'm not a general surgeon, but the general surgeons in my geographical area, in Canada especially, are there are some who work in teaching hospitals, or who do and may be involved with research in trauma and other things like that. The majority do have their own private offices where they are doing they'll do surgical procedures in the hospital, like laparoscopic cholecystectomies, removing the gallbladder, maybe some work with the breast and other things, and largely will have their own private offices. So that's in Canada, in my area, that's usually what happens.
Okay, cool. And then one of the questions we have in the chat is, have you ever done something wrong in a surgery and did it discourage you?
I don't know if the word wrong is there. I think, again, things can go, knowing that complications occur, knowing that you're human. I think you've always got to have some humility. I can't think of an event that went terribly wrong. Um, you know, the common thing is that usually patients are very, very appreciative of what you're doing, and sometimes they're not. But it's practical to realize that that you're a human who's being paid for what you're doing. You're not a martyr or a saint, and so I can't think of an outcome that went terribly bad and that there was an error or so on involved with it. So I don't. Apart from, yeah, I just really can't think of anything like that. But it can happen to anyone. And I think that's, it might just be luck that that's been my case. But it could, if you do something long enough, you're going to have a complication, and I think that's healthy to expect that.
Yeah. And the last question to wrap up this AMA is, do you have to do anything to make your patients calm before surgery?
Well, with the procedures that I do, and with any procedure, someone can be nervous, anxious, um, and I think being able to speak in a reasonable, rational tone, and trying to allay that any type of fear is the main thing, and that's a human interaction quality that you want to be, to give confidence, that um, you're in a safe environment, and um, you know, if anything is going the wrong way, we'll address it very quickly.
Yeah, thank you. So this wraps up our AMA. Thank you so much, Dr. Singhal, for taking time out of your day to help us learn something new. I think we all had like a great time and learned a lot of new things. So thank you for that. And do you have any last thing to say to the audience? Anything?
Oh, it's my pleasure to do this, and I would definitely, if anyone is interested in the medical field, I think it's a fantastic field to be involved with, and I've had no regrets having done so for so many years. I know there's a lot of competition, and there's all different paths to achieving, to getting into the field. It's a long journey in today's world, but I think it's well worth it.
Yeah, thank you once again, Dr. Singhal, for helping us learn something new. Thanks everyone also for attending and giving your attention and asking lots of questions in the chat. We'll see you in 15 minutes when our next AMA starts, and you're free to log off. Thank you all once again.